Today's video is a video for dentists talking about the dilemma of fixing this situation. My name's Dr. Ed Sherrard, and in today's video we're talking about restoring wear, specifically restoring anterior wear like this. So, we've all been in a situation, because this is a very common situation, where a patient walks into the room and they have very worn lower teeth through a history of bruxism, and in a case like this there's often some quite hard crowns in the upper arch which have been clashing against the lower teeth for years. So some patients will say, I don't want to touch it, and we obviously talk to them about the risks of if you don't restore a problem like this. But if the patient is at the point of saying, I would like to make this look better and I'd like to protect these teeth so they don't keep looking worse and getting worse, what is the solution? So this video is a case study talking about my personal approach. There's lots of different ways to do it, and there's not necessarily one specific right way. This is just what I've been shown and what's worked for me here specifically. So when you look at this, there's a lot of missing enamel across the front. So one option for restoring anteriors is always something like a veneer, but my worry here with a porcelain veneer is there's not a lot on a few of these teeth over here. There's not a lot of enamel to bond to, and I would worry about the high chance of debond of a porcelain veneer down there. If you're wanting to restore with porcelain, the next option you'd have to be going towards something like a full coverage crown, and that suddenly feels a load more destructive. So the only other option that we've got is to use composite. Now composite, as we know, wears more easily, it chips more easily, but it's equally more repairable. And in a situation like this, where you are very likely going to be changing the bite, having something that's repairable, I think, is a big advantage. So we decided to go down the route of composite. So the first thing we did was prepare the surface of the teeth for bonding. So this is a heavily sort of worn down, hard surface, and I think it's important to prepare it so it's more ready to receive bonding. The sort of gold standard thing tends to be air abrasion with like an aquacare unit. But if you don't have access to one of those, preparing the surface with some sort of polishing mechanism can work as well. So if we start off, we obviously need to etch and bond everywhere, and then we need to figure out how to build this up. So we built up probably about 8 or 9 teeth across here, and what I did was use flowable composite onto the dentine, so the buccal areas, on the incisal areas, and these whole sort of facial surfaces. So then what we're left with at that point is enamel and flowable composite covering the dentine. So that gets us to a step where we can then continue bonding and add the sort of main composite to the teeth. The reason we add flowable composite is there's very good research about bonding flowable composite to dentine and the benefit of that over just sticking normal composite on. I think the longevity and the bond strength and resilience of that bond is seen to be very good. So moving on to adding the main composite, something that I like to do is focus on getting the walls of the tooth right, so the proximal areas, because they're the areas that are difficult to sort of get the right shape, and you don't want to accidentally stick something to the tooth next door. So blue Vari strips by Garrison can be really good, or just a clear strip or a metal strip. There's loads of different things you could use, and I will sometimes go along and build up just a little bit on the walls all the way along, or equally I might put something each side and just build up the walls and the facial surface all at once, and then overlap onto the incisal edge. So I think what I did here was start with the centrals and move out. You don't necessarily have to do it that way. And I always tend to overbuild the teeth slightly, because it's always a faff if you underdo an area and then you have to go back and put the strips in again and do that bit again. So I probably would, from that point, go along, rebuild all the teeth, slightly overbuild them, lap everything over the incisal edge, maybe bring it a little bit down onto the lingual surface just to join onto the enamel, and then blend it into that. So it kind of wraps all the way over the top, and hopefully with the strips get a nice finish into the contact points as well. A little tip for building into the contact points is just making sure, if you've got a nice fine instrument, to really pack the composite in and make sure you've got a good seal of the band against the tooth. And something which sometimes works if you're struggling with that is to put a tiny little blob of flowable composite in the gap. Don't cure it, and then pack the composite, just a tiny amount, because then that tiny bit of flow can help run into any gaps that you're struggling to pack the composite into. Obviously through this you want to have good moisture control, because otherwise it's just not going to work. There's various things you could do: rubber dam, split dam, or cotton wool and aspirators if you're being very careful with it. So this is where we got to, and I was really pleased with it, but in hindsight there's always stuff that you can pick apart. The incisal edges, maybe I would have slightly changed the shape of those, but this was a review, I think like a week later or something, and yeah, so we've rebuilt the facial area, we've gone onto the incisal edges, we've polished it out so there's a nice smooth join at the gingival margins, and in a scenario like this, like I said before, opening up the bite is very likely to be what you're going to do. So doing an approach like this is inevitably, or very often, going to be taking the dial approach to it. So after this, the occlusion is going to be spread across these teeth, and the posteriors are going to be slightly discluded, and it can take quite a while for that to come back into play, and sometimes it never does, but often it does. And if it never does, then you could always build up the posteriors to meet. That's an okay thing to do down the line, or sometimes people just do it straight away. And that is one of the things which I think is really important, is getting the bite right in this sort of situation. You don't want to build up all of that and then you're just biting on this tooth here. So I spend ages after it's done with articulating paper, getting the patient to bite together, go side to side, go forwards and backwards, and just generally try and get an even spread across all the teeth. And then I suppose one of the good things about composite is because it's quite soft, you can, one, easily adjust it, and two, the patient will probably adapt into it quite well. And I've certainly found in the past the occlusion can adapt quite well to something like this. And surprisingly or not surprisingly, this was, I don't know, 4 years ago, it still hasn't chipped. So it shows that composite can be strong enough for this sort of thing. And yeah, there you go. Hopefully you find that helpful. Essentially, composite can be a good option for restoring wear like this, and it's also a reasonably forgiving option, so because of the adjustments you can make. If you've got any questions, feel free to send me a message, write something in the comments if there's anything you'd like to see a video on, and hopefully someone finds this helpful and they can take something useful into their daily practice. I'm just trying to share tips of things that have been shown to me and hope that it helps someone else. So thank you for watching.